Yeah, sure. I'll get onto my. Oh, should I probably need to? Uh, Probably need to share screen first. I could probably see my screen. Oh, just end of my presentation. You want me to start whenever? Okay, perfect. Hi guys. So I'm Dr. Sarah Ramzan. It's nice to meet you guys. So I'm a family doctor. I also do cosmetic injections, and I'm a medical director at the cosmetic clinic that I work at. And I'm really excited to speak to you guys. So I'm going to just sort of present a little bit, but you guys are more than welcome to stop and ask questions. And otherwise, you can also just ask questions at the end as well too. So this is just a little bit about me. So I currently live in Toronto in Canada, and I did my undergraduate degree in biochemistry, and then I came to I did my undergraduate degree and my medical degree both in Ottawa, and then I came to Toronto to do my residency in family medicine, and I've been living in Toronto ever since then. So I've been in practice for about 7 years now, and this is out when we were allowed to travel out in Alberta. And so just in terms of my journey, I basically did 4 years of undergraduate degrees, 4 years of medical school, 2 years of residency in family medicine. And so basically it's 10 years since the start of undergrad that I've been in school, but now I've been practicing for 7 years. So I won't tell you my age, but you can probably figure that out. So in terms of my the medical school experience, usually the first and second year classes are mostly in classroom where you're kind of learning. We actually also had a lot of problem-based learning. So that meant that we had like group settings where we would be presented with a problem, like, you know, like a 58-year-old person, a male comes in and wants to discuss, you know, his shortness of breath. And you had to sort of come up with like a potential differential as to what that was. It was more in our third and fourth year that you actually do more clinical rotations and actually go to the hospital. And that's kind of really where I really felt like you were kind of more like a doctor, where you actually had to like ask questions and take people's history and then try to come up with like a diagnosis of why the person was there. My experience really was that, you know, in undergrad, I kind of was one of the smarter people there in terms of like grades wise. And when you go into medical school, at least for me, I realized there's just a lot of really smart people who are in your class. And so sometimes you can kind of feel a little bit intimidated. I know I definitely did at some point. I had one experience when I was in my third year where I was working in the emergency department, and it was my very first shift. And the doctor I was working with, he like assumed I knew a lot more and didn't know like how the emergency department worked. And so I just know I kind of got yelled at a couple of times during that shift. And I remember at lunchtime calling my mom and like almost being teary and like tearful and like almost wanting to cry and thinking to myself, you know, if I feel this way in my first shift, like there's no way that I'm going to make it through a medical school and become a doctor. But at the end of that shift, I ended up talking to this doctor, and we kind of, came to a conclusion that, like, you know, he was maybe a little bit harsh on me, and, you know, I just didn't maybe perform as well as I could. The next time I had a shift, I ended up with someone who was really nice and very patient. So it kind of gave me a little bit of confidence, and here I am. So just to say that, you know, sometimes in your journey, you'll feel like you maybe don't belong there, but I can tell you that probably everyone has had an experience or two that's like that. In third and fourth year, you do some overnight shifts and you do like you're on call and stuff. So that's kind of interesting, having a pager and being kind of nervous to like be the first person that gets called and like not knowing whether you're going to know how to take on that responsibility. But luckily, there's usually other people on call there with you, so that kind of helps out. My advice for people would be to do a lot of electives. So my particular medical school was really lucky. In first and second year, we only had classes for about half a day. So that meant that like the other half of the day, like more the afternoon, you could study, you could go out, you could do other things, but it also gave you time to shadow different doctors. And that was really where I learned to understand what the different specialties were like, and kind of gave me an idea of I think it gave me more of an idea what I didn't want to do, to be honest. I did some research during medical school. It's not something that you have to do. I kind of sort of fell into it a little bit. I had done some research in my undergrad, like while I was in my doing my undergrad, and I just sort of continued that into medical school. My biggest advice for people would be to sort of be open-minded and not be stuck on something really specific. I know when I went into medical school, I wanted to be a pediatrician. I just thought that I liked kids and stuff, and I'll show you kind of how I ended up being a family doctor. But I knew people, I sort of came in thinking that, but I wasn't really stuck on that. I know people who came in to medical school and were like, oh, I'm definitely going to be a cardiac surgeon. And like, this is like, that's it. That's my be all end all. And some people skip classes to like shadow people. And then in the end, they didn't pick that specialty, not because they didn't get in, but because at the end of the day, they realized they liked something better. So I don't know. I think that, sometimes but sometimes you're pleasantly surprised as you go along, because there's no way you know how every specialty works until you sort of experience it. So that's alluding to my next point, which is why I specifically chose to be a family doctor. I knew from a young age I wanted to be a doctor. My favorite class was grade 11 biology, where I dissected a fetal pig. And I realized that none of my friends or my classmates were as intrigued as I was. And like I said, I thought I wanted to be a pediatrician, but specifically, I knew I wanted to be a specialist. So I thought it'd be much easier to know a lot about a very specific area rather than know a lot about a lot of things, but then kind of have to like refer out. So I chose, what happened was I like I said, I wanted to be a pediatrician, but I realized I kind of liked adults too. So I didn't know if I could just focus on kids. And the other thing I realized was that as a pediatrician, there was a lot of like genetic syndromes and really sick babies. And I realized I just like healthy babies. And so I was like, no, I don't know if I could really see myself doing that for the rest of my life. Then I sort of kind of almost switched very differently, wanted to be a dermatologist. But then again, kind of thought the same thing, which is like, I don't know if I could just do this. Like, could I just look at skin, hair, nails for the rest of my life? I don't know. So I kind of got a bit bored, even though it's not really my personality to get bored in specialties. And I went to this talk about family medicine and the different options that you can have with it. So, you can be a family doctor and work in a clinic. You can do palliative care, which is end of life care, when people are close to the end of life, time of death type of thing. You could work in the emergency department. You can work as a hospitalist. So you are kind of like one of those doctors who are in the hospital taking care of semi-sick patients. For example, someone who got diagnosed with pneumonia, and they're a little bit older, and they're a bit sick, but not super sick. Like, they don't have to be in the ICU, but they won't be able to go at home because there's no one to take care of them. So something like that, and kind of in between sick type of person that has to stay in the hospital. You could do a little specialty in skincare or dermatology. You can do cosmetics, which is what I do. You can do like just procedural based. You can do like working in anesthesia. There's one other one I was going to say. As a surgical assist. So basically, you're working with a surgeon during the surgery, but you're not the main surgeon. So there's just like such a wide variety of things that you can do. So I think that's what really drew me into choosing family medicine. Like I said, I also realized I like people of all ages, and I just didn't really want to focus just on kids. And I think the other thing that was really important for me was the concept of preventative medicine, where you get to help people with treating some things ahead of time, or like diagnosing things ahead of time, so that you don't get to a point where they're already sick. So I have a lot of diabetic patients, and so I focus a lot on my also my diabetics, but by my pre-diabetic patients, because they're the ones who are, where you think lifestyle changes are going to be really preventative. And I also like the fact that you get to know your patients. So I'll see patients, and if I don't really know what to do, I'll order some tests and I'll bring them back in. If you work in the emergency department, you deal with the emergency, then the patient goes home and you never really find out what happened to them. So it depends on what you kind of enjoy. Like, people like that acuity, sort of like that, like, excitement. It was just not my thing. So for me, I like to know what happens and like to see the story. So seeing people, I see babies when they're born, and then I see them all the way, like now some of them are like 6 or 7 years old, which kind of blows my mind. So in terms of my residency, like I said, I lived in Ottawa and then I moved to Toronto just to get a different experience for my residency. And I really realized that's when I realized I really loved family medicine. I worked in a community hospital, which basically means a little bit of a smaller hospital. There's downtown hospitals, which have a lot of the really kind of maybe you can call them cooler, more complicated cases, but we had a lot of bread and butter, which means that a lot of the stuff you'll normally see on an everyday basis. And what I liked was you worked very closely with either the family doctor or a specialist. So in Grey's Anatomy, you have or any equivalent show, you'll see there's a hierarchy. You'll have a medical student, then you'll have a junior resident and a senior resident, and then you'll have a fellow, and then you have the staff doctor. And so there's kind of this hierarchy. I didn't have as much of that hierarchy in this hospital, so I got to work really one-on-one. And so to me, I got a lot of clinical pearls that were really valuable. Not to say one is better than the other. I think that in some ways, sometimes I wish I had some of those weird and wacky, because after you start practicing, you never really go back to your training, right? So it's sometimes nice to be able to see those things. My residency was pretty cool, and then I learned a lot of procedures. So I got to do joint injections, I got to do IUD insertions, I got to do skin tag removals or mole removals, etc. So I really enjoyed that part. We had to do 2 months in a rural location, and so you get to practice in a very different way. Some of these places don't have X-rays or ultrasounds or imaging or blood tests during certain times of the day or at night. So when people come to the emergency, you have to figure out is this really an emergency? Do I have to send them to another hospital? Because otherwise, if they can kind of go home without me ordering a test, that might be, you have to figure out which one is the best alternative. For me, when I was younger, I just thought that family doctors dealt with cough and colds mostly. A bit naive. It's mostly because that's what I used to see my family doctor for. And I realized when I started to practice or even get into my residency that that's a very small proportion of what we actually do. Obviously, we had to do in Canada, these are the equivalent to the licensing exams. So you have to do some licensing exams to sort of complete your residency. One thing that I realized that no one really teaches you is the fact that, when you're a doctor and you're working, you're actually an independent contractor. So you're almost like a business owner. And no one teaches you the business side of medicine, which is how do you run a practice? How do you bill? How do you get people to come to your clinic? All that kind of stuff. So that's what I really learned in the last, mostly the last year of residency, to prepare myself to get out into practice on my own. So when I eventually, finished all my exams and I graduated, now I'm a full-fledged doctor. And in terms of finding a job, I was pretty lucky. One of the doctors I worked with, one of her friends was going on maternity leave, and she asked if I could take over her placement for 9 months, and I agreed to that. But I had 2 months after I graduated that I had some time, and I didn't know what to do. So I looked online, found a job, and I ended up working, I went to this clinic, which is the same clinic that I currently work at. And it was not at all where I would have seen myself end up practicing. And this is where, you never really know how life turns out. Where I did my training was a very affluential area just by fluke. And so, there's a lot of, we call them worried well, people who tend to not be super sick, but are very anxious. And here I ended up in a population where, in a very low socioeconomic population, which meant that things I would prescribe, in terms of medications, people couldn't afford them. So I had to sort of change my practice really going into this area. And it really actually taught me a lot. And I realized I really like this population because you teach people even really simple things like using Tylenol for pain or Gravol for nausea, things that I thought kind of were taken for granted, but people don't know these like simple things. So really simple education is so important for these people. So like I said, I find it really challenging at sometimes because some things are really heavy in this area in terms of like emotionally, but also really rewarding. And I found that in this area, people really wanted to know my opinion. Like, whereas in an affluential area, everyone wanted me to refer, like, oh, can you just get me an opinion? My cousin's brother, someone is like a, you know, specialist in this. And so I felt like I wasn't doing as much in an affluential area. One thing I worried when I was practicing on my own was that, you know, if I run into a problem, like now that's it, there's no one to help me out. Like I have to be the be all end all. And we still have a group chat, a WhatsApp group chat with my friends from residency. And if we kind of run into a problem, obviously you can't give super amount of details, but like a rough idea of what the case is. And we run ideas by each other. So in the end, you kind of realize it's not as scary as you think it is. I got asked to sort of talk about what my typical week is. So this is like during COVID. So on Mondays, I don't tend to be working. I do a lot of like paperwork, catching up on stuff, some virtual consultations at the skin clinic I work at. Tuesday, Wednesday are 2 days where I do virtual calls for patients and then review their labs and blood work and that kind of stuff. So it's very interesting. Instead of me going Tuesdays, Wednesdays, and Fridays, I would go into the clinic. And now I do mostly calls from home. On Thursdays, I'm usually in the cosmetic clinic doing injections, and I can talk briefly about that. But then I actually usually come home and actually check my test results too. So just to keep on top of things. Friday, I'm in the clinic seeing patients, and so I have to be really particular about who I bring in because I can only come in half a day, just mostly based on the clinic's and the government's recommendation of limiting inpatient visits. And sometimes on the weekends, like yesterday, I was still checking up on some blood work and doing some paperwork. So you can be doing work on your off hours, but the thing with being a family doctor is you can really work as little or as much as you want, as long as you're not based solely on being in a hospital setting, which then you might have to rely on the hospital schedule. But like if I didn't want to like work a certain day, I could probably just not work a day. So you can be pretty flexible. In terms of the limitations now that we're in COVID is the fact that you obviously can't see as many patients. But I was really surprised because now it's been over a year that we've been doing this, but I'm surprised that we can actually do as much as we can. If patients have a rash, I can ask them to send me a picture. You technically can do video call and there's no reason you can't. Just my population, a lot of my patients either don't have computers or don't know how to use computers or don't have an email. So there's a lot of limitations specifically in my population. So that's why I just stuck to doing phone calls, but there are definitely modalities where you can have like a safe video chat with patients, which I think a lot of doctors are doing. I can email people requisitions. I can send prescriptions to the pharmacy. So all like paperless, which is kind of cool. If someone calls me, it's not so much anymore because people seem to understand, but if someone sounds like they have some COVID symptoms, I'll send them to go get tested. Or if I feel like they're really sick, I send them to the emergency department. You know, if I listen to someone's story and I'm really concerned about what I hear, I'll tell them to go to the hospital. But I think in the last year, I've sent maybe 3 people to the hospital. So like, I feel like we've been able to, or at least I've been able to keep a lot of people out of hospital just by organizing a lot of stuff and just following up really closely with them. If I listen to a story and realize that I have to see someone in person, then I just book them in on the Friday that I'm there. We obviously have to be in full PPE, like gloves, masks, face shield, gowns, all that kind of stuff. Everyone's screened at the door, and we try to limit our interactions so to keep everyone safe. Normally this is like pre-COVID. My normal day would be usually mostly my clinic days, which would be Tuesdays, Wednesdays, and Fridays. I'd be there from 9 to 4. Usually end up a little bit after 4 just because you're doing some paperwork and I didn't want to bring as much home. Patients are usually booked between 9 and 12, and then lunches between 12 and 1, and then you start again back at 1 to 4. I'll be honest, a lot of times during lunchtime I'm still kind of half doing work. Otherwise I know I'm gonna have to be stuck with it when I go home. So it is pretty steady in terms of my day. I see about 24 to 30 people per day, 10 to 15 minutes per person. It varies. Some people come in and they just want like a blood work requisition or a prescription. That will take me about a couple of minutes, won't be very involved. Some people tell me about some really emotional stuff. So sometimes 15 minutes isn't enough. I have to kind of like give them extra time. And you just have to adjust your schedule accordingly. I try very much to stay on time, but sometimes you can't really do it as much as you can. So the stuff that I see on a very regular basis is I see a lot of babies as we do the well baby checks. We, give them their needles. Actually, I don't give them, the nurse gives them. I see a lot of pregnant women. I have tons and tons and tons of diabetic patients and patients with high blood pressure. So, you get very, very comfortable in dealing with those issues. And I see a lot of mental health, and obviously a lot more during COVID, just because of everyone, being mostly stuck at home, and, especially different age groups, people trying to work. And then, if they're working in places where there's been COVID outbreaks and coming home and then worried that their family may get sick. So this is, a lot for a lot of people. I don't get paid to look at my test results. So, imagine every time you order a test for a patient, there's not going to come back right away. So I have to sort of set aside time to do that. In terms of like what kind of, just to give you an idea, like the variety of things that I see. So one of my patients is 50 and he's diabetic, and he's supposed to be, he is on insulin, just chooses not to sort of take his insulin on a regular basis. So he ends up constantly in the hospital, and his sugars are often super high. And as a result of that, he's had several uh, of his fingers or toes amputated, which really sucks. And he just doesn't want to change himself. So one thing that was really, really hard for me was to accept that, you can help people, but they don't want to be helped. So that was really interesting, and sometimes still hard for me to accept. I have another patient who's got borderline personality. It's mental health condition, and she basically presents with a new problem. Like, I probably talk to her like every 2 to 4 weeks, and there's always a list of problems. She probably sees like 10 specialists that she sees for various issues, and there actually are things that are really there, but sometimes dealing with her is kind of a bit emotionally draining. We have to really set boundaries. So she's probably one of my most challenging patients. One of my most interesting patients was a guy who came in who had told me that he had a wiggle in his leg, which I thought was, most of my patients, like I said, the English is not always their first language. So actually he's Jamaican, so English is his first language, but I just, they have a different vocabulary. And so I thought like the wiggle meant that he had like a nerve problem. Anyways, he told me that he had, noticed something like a funny feeling. And so anyways, he had a Band-Aid on his leg. And when I opened it up, there was a hole, and I looked inside and there was this little bug or something inside there. I actually didn't know what it was. And I was like, oh, you have something inside there. He goes, oh yeah, I had a couple of these. I took them out like yesterday. And of course I'm freaking out. He's diabetic. He just had a heart attack. And so, he is like really high risk to get a really bad infection. And I was really concerned for him. Turns out I looked at it again and I was like, I think it's a maggot. And I took it out. I got clean forceps, which are like the little tweezer like things. And I grabbed it and I like put it in a urine bottle, send it to the lab. And hilariously, the lab sent it back, basically confirming it was a maggot. So and I told him that he had to go to see like a wound care doctor right away, and so that they can monitor it. And he's like, nah, it's okay. It's too far away. I'm like, it's literally like 10-15 minutes away. He's like, no, man, it's okay. And I'm of course freaking out. So I tell him at least to come back and see me in a couple of days, because I guess it was like, a couple of minutes away from where he was living. And so he did. And because maggots actually kill dead skin, or help with wound clearing, so it actually did improve, so it was okay, but could have gotten really a lot worse. And then I have like a 101-year-old patient, and he's pretty healthy, and he can't hear very well, so you have to yell, so it sounds like I'm upset at him when I talk to him on the clinic, but he line dances and he's otherwise pretty healthy. So just get like a really wide variety. Every day is completely different. I never know what's going to happen, and so that's why I kind of enjoy it. The big downsides I find with family medicine is a lot of paperwork. So like I said, when I take care of people's test results, people come with a lot of forms, whether it's like insurance forms, people are off for work, they got injured at work, they're applying to medical school or like nursing or any of these schools, they need to have all these forms that say that they completed all of their immunizations and etc. So yeah, I think that's the part I hate the most. A lot of times people will see their like a specialist, and if the specialist it's not in their area of expertise, they'll just say, well, go see your family doctor. So sometimes things get sort of dumped on us and we end up like because we're kind of like the first person that people see. I don't get this as much, but some people are, if for some people I call them referologists, basically, people don't really, not that people don't trust us, but they just think that, if they see a specialist, they'll get their answer a lot faster or better, even if it's something that I can easily deal with. So people will call me like, oh, I just want to be referred, which is sometimes kind of annoying. Sometimes, it's easier to not have to deal with that. In terms of getting paid less, I mean, it obviously will depend on a couple of things. How much you're working, what kind of work you're doing. Like if you're also working in the hospital and doing that kind of stuff, I feel like, it's relatively, it could be comparable to some specialties. You're not going to make as much as like a surgeon who's working like extensively in the hospital and like, is doing all these overnight shifts, but they're also working a lot harder. And obviously their skill set in doing those surgeries, like they also spent like anywhere from like 5 to 7 years doing their residency. And I spent 2 years doing a residency. So you have to sort of put into perspective. My good friend who's a general surgeon and now eventually became a thoracic surgeon, she just graduated. I've been in practice almost like 6 years at that time. So, yeah, she probably, I don't know how much she makes, but I'm sure she makes more than I do. But she also had a much grueling process. I got a really head start. Depends on if finances are important to you. I would say for me, the most important thing was having a balanced lifestyle, which I think is most important to me. And, I think almost everyone still makes money. So I don't think that's a big issue in the end. Some people are really challenging. A lot of mental health can be kind of difficult. I also find that if you work full 5 days a week in family medicine, like just seeing patients, for me, I find it kind of mentally draining because to be that empathetic, you kind of end up a bit drained from all the like constantly having to like have people tell you all their problems. So I work as a cosmetic injector as well too, and I just felt like I wanted to do something that was, more hands-on, and it was also the family clinic I was working at. They only had space for me 3 times a week, so I ended up doing like a course on it, and then I ended up finding a job. And about a year ago, they they asked me to be the medical director there, so took on that role. So I mostly do sort of like non-surgical stuff like Botox fillers, and then do some butt lifts and PRP, which is plasma rich protein. You guys can ask me more about that if that's an interest. But I really like it. It's very different than what I do, and it's a very different population, but I think it sort of like keeps me a bit sane with everything else. In terms of what I wish I knew that, going in prior, I was very I was pretty OCD and very like I felt like everything has to work out in a very specific plan. And I've come to realize, which is sort of a bit obvious, but at that time was not obvious to me, which was like life and medicine are journeys, and you're gonna have good and bad times. And it's okay if you change your mind. I changed my undergraduate degree and still ended up here. You learn a lot about yourself. I think medical school in particular, you get put into a lot of really awkward situations and difficult situations that now almost nothing kind of gets me anxious. So I definitely find that that's something I learned. One thing also is that they don't teach you how to deal with money. So I would suggest if, no matter what you do, that you just, being good with money, regardless of, again, whatever profession you do is really important. And we definitely don't learn how to run a practice, the fact that we're self-employed. So I feel like that was something that I had to learn kind of on the spot. I really love what I do, and it's really rewarding. It is a lot of work, and so you have to be really dedicated and really, really enjoy it. And I would suggest doing things that are outside of medicine, and having the right, group of people outside of medicine, I think, is so important. And I've just learned to try to like live life to its fullest and take on opportunities and like sort of push myself in things that I didn't think I was going to try. And you might not like everything, but at least you know you tried it. And I've been really, in the last little bit, also trying to focus a lot on self-love, because as I went through my journey, I was really harsh on myself when things didn't really work out, or if I didn't feel like I was good enough. And you realize that, eventually, while I was in medical school, I think I said that like I felt very sort of like that maybe I didn't belong because there's all these smart people, but I realized I found my space in medicine. Some of my friends who are really, really smart, I don't think they'd be as good of a family doctor as I am, because you have to have a different skill set for being that versus being a surgeon. I don't know if I'd make a great surgeon. So I think everyone finds their space. And so it's okay if you, like struggle in kind of finding it. I didn't choose to be a family doctor till I was in my third year of medical school. I had to sort of make a final decision. So that's it. I just sort of thought I'd leave it at that. And I know this meeting ends in 6 months. If you guys have more questions, that we can come back and you guys can ask me more questions as well too. But I guess I'll leave it at that.
Yeah, thank you. That was a really nice presentation. I think we definitely learned a lot. If anyone has any questions, you can feel free to type it in the chat, and then Dr. Sarah can answer that.
Yeah, let me just see. I'll go into the chat right now. Oh, so I got asked about my degree in biochem. So I was actually in biopharmaceutical sciences and I switched to biochem, and they're pretty similar in the sense that, and actually, I'll be honest, the reason I switched was we had to do a course in bioethics, and I wrote this essay, and for some reason, like whoever the TA who marked it, like just did not like it, and I wouldn't say I failed, but I almost failed. And I knew that was going to affect my ability to get into medical school. So I dropped the course and I switched my major. And I was so upset about this, but it actually turned out to be the best thing, because biochem was a little bit more, I think, the direction I probably would have wanted to go anyways. Like biopharmaceutical had more organic chemistry and biochemistry had more biology and stuff, which is just what things that I like. I think any science degree can be difficult, but you actually don't have to do a science degree. I have people who've done math degrees, engineering degrees, nursing degrees, like English degrees. You definitely don't have to be just in science to get in. I didn't minor in anything. Someone asked me about what PRP is. Like, sure, PRP is plasma rich protein. So what happens is you draw your blood. Someone draws your blood, you spin it down in a centrifuge, and you take the part that's rich in plasma and platelets. And what that is that's really good in rejuvenation. So you can take that and you can inject that. So I do cosmetics, so you put it back onto the face. It's basically what they call the vampire facial. But you can also use it for other things. People who've got like tendon ruptures, like if you rupture a tendon in your elbow or your Achilles tendon, which is in your foot, you can actually inject it in there with the hopes that you're going to rejuvenate whatever's there. So on the face, it's just sort of like give the skin a better glow and to sort of like help with that. Someone asked me about what classes I took in high school that really helped. So for me, biology and chemistry, I think, but really for sure, I think biology. That was like the moment, I think, the fetal pig dissection. Though the formaldehyde gave me a headache. That's the preparation they do. But I think that was really when I knew. I always thought I wanted this, but I think that course really like helped it. And then I think I always knew I wanted to do a science degree. Just sort of, I think that part I knew. But like I said, you can actually do anything as long as you do all of your like mandatory courses, like your prerequisites to get into medical school. Oh, okay. So people asking what you guys can do in high school to help you. So I volunteered at the hospital, but I worked at a Saturday school. It was like a language school, and I worked there like every Saturday for about like 8-9 years kind of thing. But any extracurriculars, you got to do something that you love. I did a lot of stuff through the school. Like I did a lot of like fundraising and that kind of stuff. But sports, being on sports teams, I did piano, I did taekwondo, like anything that you have a passion for. And I would suggest that when you actually do the activity, like write it down, like, the dates that you started, like how long did you do it? Like if you had a supervisor or someone that you worked with, so that, because like 3-4 years afterwards, you totally forget all this information. So having that all kind of there. I worked working in a hospital, great if you have the opportunity. I don't think you necessarily have to. Ask around, I think, is the other thing. It's really hard during COVID. Like even I want to help students out, and I can't bring people in, whereas otherwise I'd be more than happy to do that. Yeah, so someone asked me about volunteering. Yeah, so like I said, I did that. I tutored in when I was in university, but I tutored some high school students as well when I was in high school as well too. But you can really do anything you like. I think showing that you're well-rounded helps. So like, if you're like I said, a captain of like some sports team, or you do like sports in any capacity, like I think that's it. Because to play sports, you still have to have like teamwork, and like, you can use any opportunity as long as you can say what that opportunity brings to the table. So, like this helped me, and like, my working in the language school helped me in terms of like working with people who are from like low socioeconomic areas, people who don't speak English. Like that cultural part really was helpful. In terms of subjects to study to get into medical school, so if in high school, I think, even if you do like the basics, I think is totally fine. I think mostly sciences and English, but like I didn't minor or anything, but I really liked psychology, so I think a lot of my electives were in psychology. I didn't end up doing a minor in that. I think we're about to end soon, but like you guys I have no problem, I can rejoin, or you guys, like my Instagram handle is Hey Dr. Sarah, my email is drsarahramzan@gmail.com. You guys can email, whatever you like. Yes, okay, perfect. Yeah, not a problem. I'm more than happy to answer any questions that you have, and I'm sorry if we get cut off, but I'm so glad that you guys asked me to come and join, and I do chat a lot, so feel free if you do want to ask me more questions. I'd be happy to answer that as well too.
Yeah, thank you so much.
Like 1 minute left.
Yeah, I know. That's why I was rushing a little bit to get through the answers. Not a problem. Yeah, no, I like to sort of give very like, whatever practical advice, but yeah, like I said, any time that you guys want. Thank you guys. Oh, you guys are so sweet. Thank you for all your messages. I appreciate it.
Yeah, thank you so much for coming, Dr.
You're welcome. You're welcome. I hope you guys all have a good rest of the day.
Bye. Have a nice day.
Thank you.
Thanks.
Bye.
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 I'm just gonna wait for the timer to end.
Yeah, no problem. No problem. Yeah, I had like a good 30 seconds. I could have talked more, right? I'm just kidding.